When a customer gets started with care pathways, we normally advise that they start small. They look at a specific problem that they want to focus on, and actually the number of people who may be impacted by the changing process is quite small. So we may want to work with a specific team of clinicians, say pre-assessment nurse practitioners, and we start small. We think about what their process of care needs to evolve to, and we work with them to make sure that suits their workflow, and then we create our digital pathways to match. A key element of all implementation of pathways is to understand what success looks like. So making sure right up front we've determined what the appropriate KPIs are, and then really crucially understanding how or where would we collect data to make sure we can demonstrate improvements in performance, in activity and in outcomes.
Building solutions is very much a team effort. I am a solution specialist, so I work on the actual design and configuration of the solution. That involves working with our business analysts and the client to gather the requirements and come up with a design that's going to meet all the client needs. Once we've got that design, the project managers get involved as well, and we go about a plan for how we're going to take this from requirements through to build, testing and go live. Once we've finalised all of that, we get on with the build, and that involves myself and some of my technical counterparts, sometimes engineering or our DevOps team, to get a site set up, configured with all of the functionality that clients are going to use and the relevant pathways that they're going to be using into the system. Once we're happy with the configuration, we do a final round of internal testing here at Lumeon before we hand it over to the clients for user acceptance testing. It's a crucial phase. At that phase, they'll be going through their own test cases to make sure what we've built actually meets their requirements. Then we start getting ready for go live, so that includes ensuring all of the end users are trained, and then we go on from there towards the go live. As we get closer, we get the support team involved, carry out a support handover. We generally consider that the project's completed a couple of weeks after go live, and the client's happy with the system and it's stable, and they're dealing with support from that point going forwards.
Once we've got a care pathway implemented and live, making sure that end users are using the pathway in an appropriate way is really important. Without getting adoption early on, hitting some of those KPIs and outcome markers becomes irrelevant in such a case. Once we've gone live, it's really important that we engage with those end users in those first 1 or 2 weeks to make sure any teething problems are addressed, make sure they understand what they're doing, and to actually monitor the usage of the pathway. As a customer matures, we can think about moving or extending that pathway either into different sites or longitudinally into different departments within a hospital. And ultimately we want to get to a place where customers feel that they understand enough about the Lumeon platform. They look at it as an enterprise solution, and the majority of their quality and transformational projects, Lumeon becomes a key tool in enabling those.